Morning, I am joined in the room by State Epidemiologist Dr. Josh Clayton and the Secretary of Health, Kim Molson-Risden. First, we will hear some updates from Dr. Clayton, and then Secretary Molson-Risden will also be providing some updates.
All right, good morning, everyone. Today, we are reporting 1,047 new confirmed cases and 244 new probable cases. This does include 54 new hospitalizations, as well as 47 new deaths. We did have 475 individuals newly recovered from COVID-19 and are no longer able to transmit the virus. We also had a total of 5,349 new tests that were reported to the South Dakota Department of Health within the past 24 hours. This does bring our totals for COVID-19 in the state to 76,438 total confirmed cases and 5,765 total probable cases. Of those, 14,857 are still considered active infections, and we've had a total of 66,531 individuals who have recovered. We currently have 531 individuals hospitalized, and we've had a total now of 995 deaths. We do have a total of 620,883 total tests that have been reported to the South Dakota Department of Health since the beginning of the pandemic, and that is among 332,540 unique persons. I would also like to just provide a few other quick updates. The first is regarding the use of technology for our outreach. So we are using technology where that individual may receive a text message from the South Dakota Department of Health or an email to their personal email, asking them about their asking them to click a link to provide some information regarding an important health matter. Individuals also have the opportunity, if they want to verify that is a message from the Department of Health. There's a second part of the message where they can click a link to verify the information that we are providing and why we're reaching out to you. So there are two links in the message that we do send out, and that is a transition away from the phone number that we mentioned on the last media briefing. The other thing I would like to mention just briefly is that we, for some individuals that had received some of those text messages or some of those emails, we did have a small hiccup with messages that went out, whereby some individuals received up to 7 specific text messages. And so, of course, when you're looking at, you're receiving multiple messages within a span of several hours, you may think that is truly spam. I wanted to let folks know that we have resolved that issue with the vendor that we're using, and that issue should no longer arise. But did want to let folks know that we are using technology more, and that is having a very positive impact in terms of our ability to reach people and notify them of their positive test results and receive information about their close contacts. The second update I'd like to provide is related to the deaths that we reported for yesterday's update. So we did have a death that was originally reported among a person in the 50 to 59 year age category. We did receive additional information and that allowed us to update that person's age. That person was then listed in yesterday's update as a 70 to 79 year old. So of the 3 deaths that we reported yesterday, the 2 new ones were among 80 to 89 year olds, individuals who are 80 years and older. And the third update I'd like to provide is, I think you've been hearing a little bit about this, is the modification to CDC quarantine. And so CDC, as the standard, has recommended 14 days of quarantine from the last date of exposure to a person with COVID-19. The quarantine period does equate to the length of the incubation period, so that's why we use 14 days. And that's typically how long it takes a person to become sick once they've been exposed to a person with COVID-19. Now, the additional information as COVID-19 is rapidly evolving has allowed CDC to provide two alternatives to states that allow us to use some additional information to release individuals from quarantine earlier than that 14 days. The two pieces of information are whether a person has developed symptoms or not during their quarantine period, and whether a person has a test that is performed at a specific point during their quarantine. CDC has provided those alternatives, and South Dakota Department of Health has adopted those alternatives. And so starting tomorrow, what you will see is that this modifications to our quarantine do mean that individuals may be released as early as 7 days into what was a 14-day quarantine period. This assumes that the person has remained asymptomatic for that first 7 days from their last contact with a person with COVID-19, and that they also have a negative test, and that test can either be a molecular test or a rapid antigen test. Now that test can be collected at any point starting on day 5 or later, but the test results does have to come back, and the individual has to have that test result show a negative test result before they can be released from quarantine. That does mean that for many people that after day 7, so starting on day 8 of what had been their 14-day quarantine period, assuming they have no symptoms and assuming that they have a negative test, that they can be released and go about their normal activities, return to work, return to school, return to activities within the community. We do ask that those individuals continue to monitor their symptoms for the duration of that, what would have been that 14-day quarantine period. And that's just to make sure that if they do develop symptoms, that they then will go home and that they will seek testing to assess whether they may be infected with COVID-19. The second option is that individuals can be released from quarantine after 10 days. This is going to be more or less the standard now for within the state of South Dakota. It assumes that the person in their quarantine period has remained asymptomatic, so that they have no symptoms, and that even though they do not have a test, they are able to be released after day 10. So again, for the remainder of that quarantine period, remainder of that their monitoring period, so on day 11, 12, 13, and 14, we're asking those individuals to continue to monitor their symptoms, and if they do develop symptoms that are compatible with COVID-19, to stay at home and to seek medical care.
All right. Thank you, Dr. Clayton. This is Kim Alstom-Risden. To go along with that change in the quarantine period, we will be expanding the at-home saliva-based PCR testing for what had been for household contacts to all close contacts of COVID-positive cases in South Dakota. And so that will be something that will be made available to any close contact that is identified. And again, just to reiterate, we talked about this on prior briefings. This is a saliva at-home test, and the way it works is the person orders the test from the company. It is shipped to their house overnight. They then get on a always revolving Zoom meeting for help with collecting the saliva specimen and packaging that saliva specimen, and then they drop it in an overnight mail with an overnight mail carrier. The postage is prepaid, and it's shipped directly to the laboratory for processing. We've had over 500 now, I believe, household close contacts who have ordered their tests, and so that has gone well, and so we are going to be making that option available to all close contacts to help them, effectuate that 5 or 6 day testing if they want to have that quarantine period potentially end at 7 days. So we will continue to provide you updates on that as we have more details, but we will be making that option available starting today. The other update that I wanted to provide was some details around the mass testing events that we have talked about here the last several weeks. Again, these are the testing events that we held in 10 communities with the help of the National Guard. They were drive-through events, and people self-administered that specimen collection. Overall, we have seen 7,901 individuals tested. So far, there have been 524 positive cases. We are still waiting for some results, and so we will finalize that, but we do believe that this is that the results that we have so far are indicative of the overall results that we will see. And overall, across the sites, we saw a 7.4% positivity rate. So you might remember earlier on with some of the earlier sites, we were seeing about a 9 to 11% positivity rate, but after getting through all of the events, that positivity rate looks like it's about 7.4%.
Okay, with that, we are going to open the phone lines for questions. Can we please have the first question?
Tom Hanson from Kello.
Go ahead, Tom.
Yeah, I'd like you to expand on the mass testing in the Sioux Falls area and let people know where they can get tested and why they should get tested and who should get tested.
Thank you, Tom. This is Secretary Malcolm Risden. The mass testing that we were just talking about was community mass testing that was already conducted, and so there are not future community mass testing events with the National Guard scheduled at this time, but there are several testing options in Sioux Falls, both through entities such as Avera, who has at least 2 drive-through sites in Sioux Falls right now, Sanford as well. The city of Sioux Falls offers testing, and so there are several testing, Hy-Vee pharmacies in the city of Sioux Falls offer testing, so there are several venues for people to get tested, and we encourage anybody who has symptoms, anybody who's been in close contact, to use that testing option so that they know if they have COVID or not.
Okay. Can we please have the next
Jacob,
question?
with Dakota News Now.
Go ahead, Jacob.
As the UK just approved a vaccine and the United States seems around the corner, what is the Department of Health and what is the state doing to prepare for a vaccine to come here?
Sure. So we've been working on a vaccination implementation plan now since August with various stakeholders, including healthcare providers across the state. The ACIP group just met yesterday to talk about who should get the vaccine first. And they concluded, as we have been planning, to allocate our first doses of vaccine to what we would consider frontline healthcare workers. Those would be healthcare workers in settings who are working directly with people with COVID. And by healthcare workers, I want to just be clear that that means all of the workers in those settings. So that could be people that are helping with keeping rooms clean. It could be people delivering meals. It's really all of the folks that are taking care of patients with COVID. So we anticipate that will be the first group that we start with. Our initial vaccine allocation will be lower than what that need is, and so we will be working to prioritize to get that first group through. From there, we will move to long-term care residents as our next priority population. And then from there, we will move, all of the speed of this really depends on the number of vaccines that we are allocated on a weekly basis. As we see the Moderna vaccine come online, that will obviously help. And so we will be, getting things allocated in a very timely way so that we can get those vaccines administered, within a matter of days of them getting to South Dakota.
Okay. Next question, please.
Jackie with
Mayor, Caroline News.
I heard Jackie.
Thanks. On the same line of vaccines, Secretary Malcolm Risden, can you talk about some of the factors that you're taking into consideration when the state is deciding how to prioritize those initial doses that come in, and especially as it relates to the three major healthcare systems?
Sure. So that's a great question. Thank you. So again, we want to make sure that our healthcare workers who are taking care of our COVID patients have the ability to get vaccinated, because we know that they are on the front lines, and we need them to continue to be able to provide care to people until we're over this pandemic. And so that does not necessarily mean all healthcare workers. This is really going to be first for those folks that are working in those most intense settings, taking care of folks with COVID. We know that happens because of the way healthcare happens, most often in Sioux Falls and Rapid City. And so, again, we're anticipating our first allocation, the very first week's allocation, to be about 7,800 doses. That means 7,800 people will be able to be vaccinated in that very first week. And we know we've got, many, many healthcare providers working on those front lines in those largest communities. And so that is where we will start. And then as we get additional vaccine, we will continue to work through that same population in other locations, as well as moving on to the long-term care residents. And so, again, how fast we can move to those different groups really does depend on how much we are allocated, but that is how we will start.
Okay, next
Jacob
question.
with Dakota News Now again.
Sure. Oh, can we see if there's anybody else out there?
Yeah, go ahead. Go ahead.
Eric Matt, sure, this is the August Leader.
I heard August Leader.
Yeah, thank you. Hey, I'm curious, when would you expect to see if there was going to be a big surge that some people are predicting out of Thanksgiving weekend? When would you start to expect to see that in the data?
Yes. So when we're talking about, opportunities for individuals, to be exposed, as we had with individuals traveling for the Thanksgiving holiday, sitting down to meals with families that they may not have seen for some time. We know that the incubation period is anywhere from 2 to 14 days, and that the 50% of people develop their symptoms within the first 5 days. So we would be looking at starting at about a week after Thanksgiving to start to see some increases in cases. Now that week then does allow a couple days for individuals to first develop their symptoms, to start seeking medical care, and then get tested, and for those results to come back and be reported to the Department of Health. So we do anticipate that, starting around week 1, continuing into the second week after Thanksgiving, and possibly as long as 3 weeks after Thanksgiving to see cases increase. So we do remain vigilant, and we do ask that individuals who have those sorts of exposure risks, even though they might be low risk exposures, eating meals with families and so on, that they do, if they develop symptoms, stay at home and seek testing from their medical provider.
Okay. Next question, please.
Jeremy from the AP.
Jeremy, please.
Yeah, thanks. Just going back to the vaccines really quick, 7,800 doses, and I believe this is Pfizer, so it's the 2-dose schedule. Just wondering if you're expecting weekly shipments of doses, and if so, how many you're expecting, and at what regular pace of delivery?
So thank you, Jeremy. We do expect weekly allocations from each manufacturer, and the numbers of allocations will be different. One thing just to note is that when we get the first bolus of vaccine, so that first 7,800 doses, the schedule will be that when that first 7,800 people that get that first dose need their second dose, either 21 or 28 days later, that shipment will come to the state. So the federal government is basically holding back on the second dose that will be needed to make sure that the folks can get their full course, the full regimen of vaccine. And so that's an important thing. So when we get 7,800 doses the first week, that means 7,800 people, and we can expect to get the second 7,800 doses that we need for that group 21 or 28 days later. We do expect, we do not have the numbers for what week 2 and week 3 may look like, although we do expect it to be lower than that initial number of 7,800. We do not yet have estimates on the Moderna vaccine, but we do expect to have that information very soon.
Okay, next question, please.
This is Stephen Groves from the AP.
Stephen Gross, please.
Yeah, I had a question. I'm just trying to make sure I get a clear understanding of the data dashboard with the hospital capacity. So, right now there's 531 people with COVID-19 occupying hospital beds. And then when you look at the staffed hospital bed capacity percentage, it says there's 19.2% of staffed hospital beds occupied by COVID-19 patients. So is that 19.2% correspond to 531 patients?
So looking at overall, and I guess the 531 individuals that are in COVID-19 occupied beds does equate to the 19.2% of all available hospital beds, correct?
Okay, next
Thank
question,
you.
please.
Yep.
Deb from the Pioneer.
Go ahead, Deb.
My question is, how will you do follow-up on those who have received the vaccine to know if it's working or will they be tracked?
Yeah, that's a great question. First of all, I want to just address the fact that getting the second dose of the vaccine is going to be really, really important so that people have the maximum protection. And so, folks will, when they arrive to get their first vaccine, they will be scheduled to get their second vaccine either at that 21 or 28-day interval. And so they will go ahead and schedule that right away. They'll be given a card. They will be given a reminder before the time is to come back so that we can make sure that people do get the full two courses of the vaccine to be effective. People will also be provided information about how to monitor for any potential side effects, and that's common for any vaccine, so that people know what to be looking for and what to do if they were, in fact, experiencing something that they think might be a side effect. And so they will be provided information and have the ability to ask questions about that. There is a national tracking system, if you will, for any potential side effects from vaccines. And so that will be the system that will be used so that if a person takes a COVID vaccine and feels like they might be experiencing a negative side effect, that they can report that so that we can make sure that, again, nationally, that we're doing what we can to make sure that the vaccine is safe and effective.
And then how about effectiveness?
So, this is Dr. Clayton. There are several different mechanisms to look at the overall effectiveness of the vaccine. So while the efficacy is 95%, those are more controlled environments. We do anticipate that that would be the high end of what the effectiveness would be when the vaccine reaches the general population. And so, we continue to support by asking questions of individuals who develop COVID-19, whether they received the vaccine and checking within our own population. There are also the post-licensure monitoring that is done in specific populations that will be evaluated on an ongoing basis. So, there are a number of those sites across the United States that will be looking at the same things that we'll be looking at, a number of individuals with COVID-19 vaccination that may go on to develop COVID-19 disease. Again, we we know that the efficacy is very high, and that we do not anticipate individuals will be seeing cases from those individuals. But there may be circumstances such as incomplete vaccination where they received the first dose and have not received the second dose. And those are all circumstances that we do try and monitor to help see how effective that vaccine will be.
Okay, thank you.
Mm-hmm.
We have time for one more question. Can I have
Eric
the last?
Mayer, Kellen.
Morgan with City Journal.
Can we go with Morgan, please?
Thank you. I just wanted to double check that. Did you say the hospitals in Rapid City and Sioux Falls would kind of be prioritized for the first vaccine doses? And then maybe you could also explain how you plan to divvy up those 7,800 doses between each of the hospitals?
Sure. So we are actually working on that right now, and again, that's in partnership with healthcare systems. One point I would just reiterate from prior media briefings is we are working with the 3 large systems to really be key vaccinators of those very first groups. And so in addition to those 3 systems, we are also working with Prairie Lakes Hospital in Watertown and the Mobridge Hospital in Mobridge. And so those hospital systems, including Watertown and Mobridge, will be the entities getting those initial doses so that and helping us vaccinate individuals in those first phases. And so we appreciate all of their help with that, and they will be helping us get the numbers of staff to help us allocate those first 7,800 doses.
Okay. We would like to thank you all for joining us today, and have a great rest of the week.